Hi, I'm Rich Ribeiro. The Terrell Fund is committed to educating the public about the need to support New Jersey's infants and toddlers right from the start. That's why we're proud to support the important early childhood programming produced by the Caucus Educational Corporation.
State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by the Terrell Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, the New Jersey Education Association, NJM Insurance Group, Berkeley College, Wells Fargo, and by Summit Medical Group, a multi-specialty medical practice providing comprehensive care from birth and pediatrics to geriatric care, concentrating in general wellness, cancer treatment, disease management, and behavioral health. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network, and by New Jersey Globe.
Welcome to State of Affairs. I'm Steve Adubato. We're coming to you from the Agnes Veris NJTV studio in beautiful Newark, New Jersey. It is my honor and pleasure to introduce Barry Ostrowsky, who's the President and Chief Executive Officer of RWJBarnabas Health. Barry, let's jump right into this. This is part of an ongoing series we're doing on the future of healthcare. The connection between RWJBarnabas Health, Rutgers, as it relates to cancer care. Talk about it.
Yeah, we're excited, of course, about our partnership with Rutgers. One of the things that Rutgers has is the state's only designated cancer center, which is the Rutgers Cancer Institute, which is located in New Brunswick. We've decided to take that Cancer Institute and spread it throughout our healthcare system so that every venue we have will have services that are generated by that Cancer Institute. The research will be done primarily in New Brunswick at a new home for the Cancer Institute that we're planning right now and will be constructed over the next number of years. And what most people don't know in New Jersey is that Cancer Institute is a world leader in something called precision medicine, where we're now treating patients with cancer using their own biological blood and other types of injections that we use, where we feed back to the patient that which they have. Best way to, in fact, will be the best way to treat many of these cancers. So that is the home of that kind of research. We also do clinical activity there, but the clinical activity throughout our system will in fact be linked to the great experts of the Cancer Institute.
In fact, that is why the question about the future of healthcare, because that is in fact part of the direction. And technology has a lot to do with it. Innovation has a lot to do with it.
Well, innovation and technology, and I have to tell you, Steve, the future of health in the United States, and we make a distinction between healthcare and health. Frankly, our mission is about the health of the community. Healthcare is frankly just vending healthcare services. We feel our mission is to enhance the health of all those that live in our communities. So there's really at least a dual-prong approach to that. You have to have a platform that's clinically based, that has academics, that has research, so that you can assure folks who live in the communities that they can access the best clinical care. But 3.5 million New Jerseyans, frankly, can't afford the basic needs of life. And that's food, and that's housing, and that's safe streets, all of the social determinants that frankly keep people sick. That combination will do best to help our communities be healthy. And that's what our new mission is. Not only the clinical side, but the social service side. Together, that's how you're going to get a healthier New Jersey.
Yeah, Barry talks about the social determinants of health. To fully disclose, RWJBarnabas Health is a major underwriter of what we do here on public television. But also, I've done some leadership coaching at your place, and this whole question of social determinants of health tied to social impact. What often, I don't question, but I want to understand more, and you can help our audience understand this. Social impact, why is it that a healthcare system is looking to have social impact as opposed to just healthcare impact?
Well, if you analyze what unfortunately makes people ill and what makes their lives less healthy and happy, it's 10% genetics, 30% clinical platform, that is physicians and hospitals, 60% is the lack of your basic lifestyle requirements. So if you can't get healthy food, if you live in substandard housing, if you're chronically unemployed,
Transportation you can't get?
if you can't get transportation, you live in a community that's unsafe, those items will make you sick. And so no matter how many doctors we put in the hospital, no matter how many surgeries we do, if we don't address those issues, we're not improving the health of the community. Now, historically, healthcare systems stayed with academics and clinical platform and research, and we do terrific things there, but we still look and we see our communities, particularly vulnerable communities, and we say, why aren't people healthier? Now, some of it means that people have to adopt better lifestyles voluntarily, but still, no matter how voluntarily you adopt a better lifestyle, if you don't have good food and you live in substandard housing and you can't get a job, you are not going to be healthy. And what happens, people who suffer from those social determinants tend to access the healthcare system on a regular basis.
Which drives cost.
Drives
By the way, we're in
cost.
Newark, and that's one of the communities.
No question about it. The
we're talking
vulnerable
about.
community in Newark is one that we're focusing on right now, but we do it in New Brunswick and Long Branch and others throughout our service area. And so if you look at healthcare and say, what makes it expensive in the United States, among the reasons is the fact that people who ordinarily could feel better with the right social platform are accessing conventional healthcare. That makes the burden on healthcare systems both expensive and difficult to meet.
The other part of the future of healthcare is getting out there more. And one of the initiatives is called the WOW Van. It's Wellness on Wheels. Explain what it is and how, again, it is part of the future of healthcare.
So WOW, the WOW vehicle, which is an RV that we've had outfitted to deliver fresh food and to teach people in various vulnerable communities how to prepare that food, is really a throwback to when I grew up in Newark. My mother had a vegetable man that came down the street. She was able to go down from our 2.5 family house where we rented an apartment and buy fresh food. You can't do that nowadays, so we have recreated that by going into the vulnerable communities and delivering fresh food and teaching folks how to prepare it. We go to schools, we go to preschools, and it's been incredibly successful for us. Folks have embraced it. So here's the issue with social determinants. If you effectively say access to healthy food is a necessity, you're going to do something like this WOW vehicle, but you're only going to deal with ones and tens and hundreds of people, and you can't be frustrated by that. It's going to take generations to address effectively these social determinants, and you will see healthier generations in the future. The investment is not paid for, candidly, by any insurance program. Medicare or Medicaid doesn't have a code that says, let's pay for healthy food.
Should it?
Yeah, absolutely. But at this point, it doesn't. And so what we've decided is to take some of the resources that we've accumulated by vending healthcare services and apply those resources to these social determinants.
Before I let you out of here, Barry, the other initiative, Rutgers is very much involved, RWJBarnabas Health, Rutgers Connection. The Rutgers, RWJBarnabas Health Athletic Performance Center, opening this summer in 2019. What is it, and why involved with Rutgers in that way? Athletics.
Right. Well, we think that we need to make a contribution to the general society of New Jersey. Rutgers is our state institution. We believe in supporting things that are New Jersey. And when we spoke to Rutgers about its needs to, in fact, make itself better for various types of students, we've invested in the medical school, we've invested in other professional schools. This was our opportunity to invest helping student athletes who in fact needed better facilities, and we're so excited about it. And the truth is, all of this is a contribution, in our view, to making the lives of New Jerseyans better. And of course, these athletes in many cases come from other states, and we want to put our best foot forward to ensure that folks have the kind of feeling about New Jersey that many of us have, having been born and grown up here. So we're excited about that, and in fact, I think when it opens, people will see a state-of-the-art facility for student athletes.
And by the way, in that spirit of giving back, let me just repeat what I said before if you missed it earlier. RWJBarnabas Health is a significant underwriter of the work that we do at the Caucus Educational Corporation, a supporter of public broadcasting. Thank you, Barry.
Thank you so much, Steve.
Well done.
Appreciate it.
This is State of Affairs. We're at NJTV Studios in Newark. We'll be right back right after this.
To see more State of Affairs with Steve Adubato programs, visit us online at stateofaffairsnj.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
State of Affairs is pleased to welcome Ralph LaRossa, COO and President, PSEG Power. Good to see you, Ralph.
Good to see you, Steve. It's been a while.
Yeah, it has. Let's put this in context. And in just a few minutes, we'll talk about the future of energy, big picture. But let's talk about what's going on. You guys have 3 nuclear plants in South Jersey. There's a $300 million state subsidy on the line as it relates to those plants. Why is that so relevant to the future of energy in the state?
So I take you back a little bit in time. We, as you know, run a number of plants up and down the New Jersey Turnpike and some other states as well. And as it relates to the state of New Jersey, we, in the past, had 2 coal plants that were in New Jersey, one in the Trenton area, one up in Jersey City. And those plants were closed 2 years ago. And we didn't raise any issues. We didn't come to policymakers. We didn't talk at all about the need to keep those plants open because they really didn't fit in the policy of the state of New Jersey. These 3 plants, and the reason that they're so important to us—
They're nuclear plants.
These 3 nuclear plants in New Jersey are important because they're very consistent with the environmental policy of the state of New Jersey, which is to have 0 emissions from the power plants that generate power to feed the residents of New Jersey. That's our policy. That's where we've been heading as a state. And these 3 plants are so key to that because they provide over 40% of the power that comes into New Jersey and over 90% of the power that has 0 emissions to it. So if we lose 90% of the power that's right. 0 emissions, that's a big impact on the state of New Jersey.
But why the state? By the way, let me disclose a couple things. One, PSEG is a major underwriter of the work that we do at the Caucus Educational Corporation, and obviously, as you watch NJTV News, they're a major underwriter of the news as well. Here's the thing that's interesting to me. You've got the ratepayer advocate and some others who are saying, PSEG, they don't need a $300 million subsidy. They're flush, you
right.
say?
All right, well, what I say is that you don't look at no company looks at one individual asset and say, well, we're going to keep that asset running. If the Dunkin' Donuts that's down the street here
right.
closes, it's because
we're downtown Newark. Go ahead.
There's not enough customers going to the Dunkin' Donuts.
Right.
But that doesn't mean that Dunkin' Donuts has to subsidize those assets and those stores that they have that aren't making any money. These plants are not making any money, and they're not making any money because we're so close to the Marcellus Shale that exists.
Put that. You're not going to open up this Pandora's box. The Marcellus Shale is
so Marcellus Shale is a gas supply, is a gas reserve that natural gas reserve that was found in Pennsylvania, and so people have been producing natural gas for the last 10 years, 15 years or so from that reserve, and as a result, they've been driving down the price of power. And as they drive down the price of power, these nuclear plants, which have a lot more expense associated with them, they tend to become out of market because we bid every day into the marketplace.
You make it sound like you can't compete in that environment.
It's tough to compete, but it's the same thing for solar, and it's the same thing for wind. So we look at any of these zero-emission sources for energy, and we say as a state, from a policy standpoint, we want to support those because we believe in having 0 emissions in the state of New Jersey from our power plants.
But Ralph, what's so interesting is nuclear is described by many as a clean source of energy.
Right.
There are others who say it's dangerous. Close them down from an environmental point of view. It seems like there's a disconnect.
So
is there a disconnect in the minds of some?
And in my opinion, there is a disconnect in the minds of some. So let's look at Oyster Creek as an example. Oyster Creek just closed recently. I think it was last October and November. It was in the state of New Jersey. There were concerns there from an environmental standpoint, not about the danger of it, but the impact on the Barnegat Bay. So there was a decision made to close it. But what has happened since Oyster Creek closed? Since Oyster Creek closed, all of that power that was generated by that nuclear plant is now being generated by gas-fired plants in the state of New Jersey.
Why is that relevant to consumers?
Because it gets back to our policy being to have a green state that wants to have their power generated from 0 emissions generators. So it'll be from solar, from wind, from nuclear over time. We'll phase out. That's the policy. 0 by 2030, 0 by 2050. That's the policy of the state and this region, New York, New Jersey, Connecticut. It's all about reducing carbon emitting generation.
So here's the thing. On April the 18th, the Board of Public Utilities, they regulate a lot of industries, including your industry. There's a vote that's being taken on this subsidy. If that $300 million subsidy is not in place, by the way, we'll have others who have a different perspective on this, on state of affairs as well. What happens?
Well,
you said you're going to close.
Yeah, the plant's closed, and it's terrible for the economy in South Jersey. And it's one of the major employers. Over 6,000 employees at different times are employed down at that plant. It's bad for the state from an emission standpoint, but it's a decision that's made by, again, policymakers. We only raised this issue. This wasn't about us making a money grab. This was only a question about whether or not we wanted to meet those environmental policies. And we thought it was important, and so we've generated the conversation. Took place over the last 12 months. At different times, it's been pretty heated.
Where's the governor on this?
Well, the governor signed the bill.
Signed the bill?
There was a bill that allowed, legislation that was put in place that allowed the BPU to make this decision. Because without that legislation being put in place, the BPU wouldn't have had the ability.
And the Senate President on this as well supportive?
The Senate President supportive. Speaker Coughlin, they've all been supportive of it. It's all passed, all the chambers. But now we have this last piece, which is the BPU looking at our books, our financial books, and saying, hey, are these plants really making money or losing money? We've provided a full truckload of information. And so they're in that process right now of going through that.
We're going to see what happens on the 18th of April with the Board of Public Utilities. I assure you that not just our operation will cover it at State of Affairs. I assure you NJTV News will be covering it as well. And again, people with different perspectives will have on it. How about 2 minutes, Ralph? Future of energy in the state. I mean, you've been touching on it already by talking about wind, solar, and other sources. Are you optimistic about the future of energy in the state of New Jersey?
Yeah, no, I am. I think so. Many times I've been on this program in the past and talked about the utility role. And in those conversations, I would tell you from a resiliency and reliability standpoint, it was all of the above. We wanted to do everything we could to keep the lights on.
Particularly after Sandy, we talked a lot about it.
A lot after Sandy. So now I've moved over to the power side of the business, and now it's the same story, though. It's all of the above. So when we look at what we need to keep the power generated in the state at a reasonable price for customers, we look at all of the above. So there is a little bit of natural gas left in the state. 50% of it is in some, that 40% I said from the nuclear plants. The rest of it is mostly done by gas generation. But the goal is to phase that out over time. We have gas generation plants, but now we're looking at what does that mean to our fleet over the long term, right? 2030, 2050. I hope we're here talking about it in 2030,
but you
2050.
Need to be looking at that,
but
though.
We're looking at it now, right? Because that's the long-term goal. So what are we looking to do?
2 seconds, go ahead.
Maybe even move into offshore wind, right? So we've had conversations with some companies about offshore wind. That's one of the next technologies that's coming to generate power, and we're taking a look at that as an opportunity for us to continue to be a supplier.
Everything on the table, but the 18th matters. With April 18th, BPU matters, that vote.
Matters more to the state now from an environmental standpoint than ever before.
Ralph LaRossa is the president as well as the chief operating officer of PSEG Power. I want to thank you for joining us. We appreciate it, Ralph.
Thanks, Steve.
All the best.
Thanks.
This is State of Affairs. I'm Steve Adubato. We're coming to you from the NJTV studios in Newark. We'll be right back.
To see more State of Affairs with Steve Adubato programs, visit us online at stateofaffairsnj.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
There he is, Michael Hill, correspondent at NJTV News. You recognize him from the studio, the set. Good to see you, my friend.
How you doing, buddy?
I'm doing all right. It is an honor to have you. Every night on NJTV News, important things happen. But one night I told you, I actually texted you while I was watching it. You did a report called Trauma, Tragedy, and Treatment, a 5-part series. Set it up.
It was part of a fellowship project for USC Annenberg Center for Health Journalism. They contacted me last March asking me to participate in the fellowship. I did. They asked me what did I want to focus on. I said trauma, trauma-informed care. So went out there for fellowship training in July, came back, started working on this series. Didn't know it was going to be 5 parts, didn't know if it was going to be 3 parts. And it was really to focus on underserved communities. Places like Newark, places like Camden. I decided to focus on Newark because so much is taking place right here. South Ward Children's Alliance, Greater Newark Healthcare Coalition, you know, Carrie Lagoso, Miseral, and others like that, Cecilia Zalkin, who are all on the ground doing a lot of work. So I decided to focus on Newark itself and just came away with just incredible stuff.
So we, in fact, are part of our production team is part of an operation called Right from the Start, NJ, looking at infants and toddlers and those who care for them. And Michael's series, and by the way, you'll see the website for NJTV, check out this series. But Michael's about to set up this clip that features a young lady by the name of Shanti Jones who not just had a big impact on you as a journalist, but on a lot of people who saw her set it up.
Changed my direction for this project, Steve. I didn't know what her story was. I asked the Southward Children's Alliance to help me find someone who could help me tell this story. This is someone who, at the age of 7, father was convicted of drug trafficking. He was in prison, so the father wasn't around. Mother addicted drugs, wasn't exactly a protective parent, no supportive parent in the household. Ashanti was 7 years old, 2 brothers in the household. One day, cops, social workers knock on the door, take the kids away. They all wind up in foster care. Ashanti hadn't seen some of them since. And she spent the next 10 years after that longing to be with a mother whom she eventually would realize the mother gave up her maternal rights. Once she got to high school, and she had some disturbance issues and so forth, once she got to high school, she had what I guess most of us would call that eureka moment.
Set it up. Alvin, our great director and the team in the control room, let's go to the clip from Michael's series on NJTV News called Trauma, Tragedy, and Treatment.
You're sitting here telling me that at 17 years old, you initiated going to the guidance counselor, telling the guidance counselor that you wanted a better outcome for your life, and you're 17 years old. And then you went from a near failing student to the next year a straight A student. Is that what you're telling me?
Absolutely. At this point, I was trying to prove something. So I was proving that I was above. Like I don't need you, you know. And so it had to be about me. And I knew that, you know, I wanted to be someone I was proud of.
Michael, why did she move you so much?
In the 40 years I've been doing this, Steve, of all the interviews I've ever had, this is the only one during the middle of the interview, the story made me cry. This story of triumph, this story of tragedy, this story of someone who, again, at 17, had the presence of mind to look at her surroundings and say, I don't want to wind up like the people around me, the people who, I guess to a certain extent, raised me to a certain extent. I don't want to be like my mother. There are opportunities out there. I need to go and take advantage of these, but I'm not going to take advantage of these and have a better outcome if I stay on this course. At 17, Steve.
Now, she's obviously a special young lady, you know, motivated and tough and dedicated to trying to be the best she can be. Is she the exception of those who have experienced what are commonly referred to as ACEs, adverse childhood experiences?
I don't know. And I'll tell you the reason I say that is because there are opportunities out there for people who've been through what Ashanti has been through and others, less traumatic, more traumatic. And one of the things that Carrie Lagoso-Meserel always points out—
One of the leaders in this movement.
One of the leaders in the movement. One of the things she's always pointing out is that there are resources there, and it's based on an individual basis to a certain extent, and how willing you are to participate in this recovery, in this treatment. But there are opportunities to do it. And that's one of the things I wanted this series to show, that as bad as things may be for individuals, there is, almost to say hope is kind of trite, but there are opportunities for recovery, for resilience, for treatment. And that's what I think this series is all about.
It's interesting. By the way, we'll put up the site again for people to see the 5-part series on NJTV News. But the other question is this. From a policy point of view, you and I have done, Michael and I, we did a very challenging and important conversation about police-minority relations a couple of years ago. And we kept asking the question, what policy changes need to be made as it relates to your series, traumas, tragedy, and treatment? What policy changes need to be made?
More recognition of trauma, better resources to try to diagnose it. You know, Dr. Nadine Berg-Harris with the Center for Youth Wellness, you interviewed her out in San Francisco.
Yeah, wonderful book out in San Francisco, right?
Exactly. And so one of the things that she's focusing on, this national—
And she's in your series as well.
Yes, she is. This national campaign to focus on pediatricians, but not just medical doctors, but
Right.
others out there in the health sector, to screen people for trauma. Not to say that everybody, just because you suffer some kind of traumatic incidents doesn't mean that you're necessarily traumatized. It depends on the individual. So one of her things is doctors should screen for this, and not just children, but for families, to find out what's going on in the household. And then I would think, based on some of the research that we did, more recognition needs to be given to trauma, more resources, certainly, and certainly more counseling and so forth.
Like I said, the series is called Traumas, Tragedy, and Treatment, a 5-part series that Michael and the great team here at NJTV News put together. We put the site up several times. Make sure you check it out. But most importantly, Michael, let me just say this to you. The work that you did here, the work that you and your colleagues do every night, that's the reason why we all got into public television in the first place. Well done, my friend.
Thank you, my friend.
Thank you.
You're welcome.
Check you out next time. Thank you, Michael.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by the Turl Fund, supporting right from the start NJ, the Robert Wood Johnson Foundation, the New Jersey Education Association, NJM Insurance Group, Berkeley College, Wells Fargo, and by Summit Medical Group.
NJM Insurance Company has been serving New Jersey policyholders for more than 100 years. But just who are NJM's policyholders? They're the men and women who teach our children, the public sector employees who maintain our infrastructure, the workers who craft our manufactured goods, and New Jersey's next generation of leaders, the people who make our state a great place to call home. NJM, we've got New Jersey covered.